30-year-old Natasha Winters is a single mother of three: Christiana, Connor, and Caleb. They live in McKinney, Texas, just outside of Dallas. Natasha works hard to manage her very active family. She does this well, even while dealing with a physical challenge that has affected her for several years.
I was 16. It was shortly after my 16th birthday, and it was literally overnight. I woke up one morning and my hands were double their size. They were extremely painful. They were swollen, very stiff, and I was in shock. I didn't know what was going on in my body, to be quite honest.
Within 1 month, what was supposed to be a time of coming of age turned into her darkest hour. Natasha was diagnosed with rheumatoid arthritis.
It's difficult enough for anybody to be 16. You know, it's a difficult time, your early adolescence. But it was more difficult for me being 16 and then all of a sudden being different from my peers. So once that began, I just began to withdraw and isolate myself.
We don't understand why people have sort of different onsets.
Let me look at your hands.
Why, for instance, in some people it'll affect the knuckles, and why someone else it'll start out affecting just the balls of their feet. Why in someone it may occur overnight and really have sort of a sudden onset, or that may have a more slow and steady onset.
Rheumatoid arthritis can start in any joint of the body, but most commonly begins in the smaller joints of the fingers, hands, and wrists. It's usually symmetrical, meaning if the joint in the left wrist begins to ache, the same joint in the right wrist will also be affected in the same way. The swelling of the synovial lining can cause pain, warmth, stiffness, redness, and swelling around the joint. As the disease progresses, painful inflammation can occur, and if left untreated, can cause misshapen joints and eventually loss of movement. Though RA affects patients in different ways and treatment is often customized to the individual, the goal is typically the same: to relieve pain, reduce inflammation, and stop or slow joint damage while improving function.
While we don't cure rheumatoid arthritis any more than we cure other chronic illnesses like diabetes or high cholesterol or high blood pressure, we control it as we do the other conditions as well.
These look pretty good, maybe a little bit of swelling here, but...
Natasha was part of a clinical trial for one of the new biological therapies that target the immune system. Her body's response took some time, and the lasting effects of the disease are visible. But for her, the end result was definitely worth the wait.
To do the simplest things and do them on your own, I think is a great benefit, and it gives you your life back.
Ready? Go! Good job!
I became a true mommy. I became a full-time mommy, you know, and I don't think I was that before. I see happiness now, more than anything.
We've always been able to control to some degree people's rheumatoid arthritis with the older medications, but there was always a need for something more. The difference is that with the biologic therapies, people feel a difference very quickly. They start to improve energy right away. They can see improvement of swelling right away. It becomes very dramatic for them.
Managing the signs and symptoms of RA has long been the standard treatment strategy. But doctors say the combined effect of new biological therapies, along with early diagnosis, have significantly increased the success rate, and patients are more optimistic about the future than ever before.